This is the urinary system beginning on page 269 with anatomy. We have an image of the female urinary tract. Urine is formed as waste materials such as urea are filtered from the blood into the tubules of the kidney. Urea is a nitrogenous waste product formed as proteins are used in cells. Urine passes from the kidney tubules into the central collection section of the kidney, the renal pelvis. Each renal pelvis leads directly to a ureter, which takes the urine to the urinary bladder. The bladder releases urine to the urethra, and urine leaves the body. Our terminology, we have cysto, this means urinary bladder, so cystoscopy, visual examination of the urinary bladder. Vesico means urinary bladder as well, so intravesical, pertaining to within the urinary bladder. Nephro means kidney. Nephritis would be inflammation of a kidney. Reno also means kidney, so renal, pertaining to the kidney. Pyelo means renal pelvis. Pyelogram, record of the renal pelvis after injection of contrast. Uretero means ureter, ureterectomy, removal or excision of ureter. And urethro means urethra. Urethritis, inflammation of the urethra. Pathology. Albuminuria, abnormal condition of protein or albumin in the urine. Anuria, abnormal condition of no urine production. Dysuria, painful urination. Glycosuria, abnormal condition of glucose in the urine. Hematuria, abnormal condition of blood in the urine. Nephrolithiasis, abnormal condition of stones in the kidney. Renal failure, condition in which the kidneys stop functioning and do not produce urine. And uremia, condition of high levels of urea, nitrogenous waste material, in the blood. Laboratory tests and diagnostic procedures. Blood urea nitrogen, or BUN, measures the amount of urea, nitrogenous waste in the blood. Cystoscopy, visual examination of the urinary bladder with a cystoscope, which is an endoscope. Kidneys, ureters, and bladder, or cub, X-ray images of the kidneys and urinary tract made without the use of contrast material. Retrograde pyelogram, or RP. Contrast material is injected through a catheter, a flexible tubular instrument, into the urethra and bladder, and X-ray images are taken of the urethra, bladder, and ureters. Voiding cystourethrogram, or VCUG. X-ray films of the bladder and urethra taken after the bladder is filled with a contrast material and while the patient is expelling urine, also called cystogram. And urography is X-ray imaging of the urinary tract after injection of contrast material, also known as pylography. Next we have treatment procedures. Dialysis. Waste materials, urea, creatinine, and uric acid, are separated from the blood by a machine, known as hemodialysis. Alternatively, in peritoneal dialysis, an intra-abdominal catheter, a flexible tubular instrument, delivers a special fluid into the abdominal cavity. After several hours, the fluid containing waste materials that have seeped into it from the blood is drained. Lithotripsy. Shock waves are beamed into a patient to crush urinary tract stones. The stone fragments then pass out of the body with urine, also called extracorporeal shock wave lithotripsy, or ESWL. Renal transplantation. A donor kidney is transferred to a recipient whose kidneys have both failed. And urinary catheterization. A catheter, a flexible tubular instrument, is passed through the urethra and into the urinary bladder for short-term or long-term drainage of urine. Abbreviations, we have ARF, or acute renal failure. BUN is blood urea nitrogen, measures kidney function. CAPD, continuous ambulatory peritoneal dialysis. CKD, chronic kidney disease. Rising BUN and serum creatinine levels affect many body systems. GFR, glomerular filtration rate, measured to document stages of kidney disease. HD is hemodialysis. CUB, kidneys, ureters, and bladder, series of X-ray images made without contrast. RP, retrograde pyelogram. UA is urinalysis. UTI, urinary tract infection. And VCUG, voiding cytourethrogram.